By now, we're all familiar with how important medical imaging is for the visualization of structures within the body. We know that it is commonly used in clinical practice to diagnose and treat cancer. But what if I told you there was a way to utilize these standard medical images to extract numbers? So this numerical data could not only help provide a more comprehensive view of cancer and other diseases, but predict outcomes for patients as well. The field I'm describing is known as radiomics, and it aims to develop, evaluate, and translate clinically relevant image analysis tools to support diagnoses and treatment in cancer. So quite generally, the process involves acquiring medical images through CT, which can be thought of as a 3D X-ray, and then identifying the regions of interest. So in this case, these would include our cancerous tumors. Next, we would extract radiomic features such as shape, size, and texture that describe these regions of interest. We collect large data sets, and finally, we'd use machine learning techniques to discover patterns within these large data sets. Our lab is currently looking into using radiomics on the CTs of oropharyngeal cancer patients. So oropharyngeal cancer originates in the middle of the throat and is the most common head and neck cancer. And the CTs that we analyze are the images taken prior to receiving radiation in the clinic. So oropharyngeal cancer is currently treated with radiation as the definitive treatment. And the good news is most oropharyngeal cancer patients have a survival rate of over 80% after receiving radiation. However, almost all patients will suffer treatment toxicity such as dry mouth and trouble swallowing because of undergoing radiation to the neck. Additionally, up to a quarter of these patients will require a feeding tube to combat nutritional deficiencies and weight loss. Currently, there are no ways to determine which patients would benefit from a feeding tube during treatment, and therefore we have this unmet clinical need to identify these patients during their cancer staging, which takes place before treatment. So all these patients get CT scanned as part of the routine clinical workflow, and these images may provide additional information otherwise invisible to the naked eye, such as the texture of a tumor. And accurate imaging features would assist in identifying the high-risk population and predict beforehand which patients could benefit from a feeding tube or other nutritional interventions prior to the start of their treatment. So to go into a little bit of detail about radiomic features, I'll show you the three main types of features that we look to extract from the tumors in our images. So intensity features describe the average brightness in an image, and texture features describe the relationships between these image brightness values. And they can provide information about the contrast or homogeneity in an image, as well as characterize the texture of the tumor. And finally, shape and size features give us information about the volume and surface area of the tumor. Using our extracted radiomic features, we can teach a computer to learn the difference between number patterns in high and low risk patients. And once the computer is trained, our goal is then to build a machine learning model to aid physicians in clinical decision making. And aside from predicting toxicities, radiomics and machine learning may also help us to predict which of the patients will suffer a recurrence, meaning that their cancer would come back despite having completed radiation treatment. And identifying this hard to find patient population early on could alert doctors as to which patients may benefit from a higher radiation dose or more aggressive treatment. And eventually we could add in features from other imaging methods such as MRI, along with patients' genomic information. And this could lead to building an even more accurate model. This non-invasive tool would be the first of its kind to integrate information from medical images, patients, and their treatments, leading to more personalized medicine options and ultimately improving quality of life for cancer patients. And with that, I'd just like to thank you for listening. I'd like to thank the RIOT team for the opportunity to speak today. I'd like to acknowledge my sources of funding and thank my supervisor, lab members, committee members, and collaborators for making this research possible. Thank you. Thank you.